Kind Clinic started because there were a group of people that were just mad enough to do something about getting PrEP into our community, and Kind Clinic was born from that. Over time, we have grown, and now we are in 3 clinics in Austin and San Antonio, and now offer our sexual health services statewide through TeleKind. I think Kind Clinic has grown into a force in our community.
Kind Clinic is unique because it is community driven. I don't think there's ever been a time where I've went to a Kind Clinic and I've just felt nervous. It was like I was approached, I was asked questions, I was asked about my well-being, and they just got me comfortable in being in that space, and I think that's the biggest thing as well.
Other doctors' offices, they may be educated and they may understand some of these concerns, but I think Kind is really engaging in the community in a way that other organizations can't or won't.
There are disproportionate impacts of HIV within communities of color in our state, especially trans women of color. We have to provide focused, intentional effort at engaging and building trust with different communities so that we can start to bend down the curve of HIV transmission in our state, especially within communities that are disproportionately impacted.
I know my team and everyone here has a passion for is to make sure that the patients who walk through that door are accepted, are feeling like they're getting prime, excellent service, and that they're getting their voice heard.
One of the most radical things I've seen about Kind Clinic are reviews from people that said they had fun. Who goes to the doctor's office and has fun?
I mean, it's always pretty joyful to walk into a Kind Clinic. Like, I'm happy, it's a lot more fun than in a regular doctor's office. And then when you go back to the back and talk to your clinician, it's like, you know, talking to a friend.
During the pandemic, our staff had to be very innovative in how we delivered sexual health services in a completely new way. We'd had telemedicine available before, but now we needed to ramp it up. And instead of going from a few appointments here and there, we changed within the course of a week to almost all telemedicine appointments. And this was a radically different time, not only for our staff, but for our patients as well. Of the values we have, trust is probably the first and foremost that has to be present. If you don't trust your doctor or provider, you're not going to get the best care. It's been such a great honor to have Waterloo Counseling Center join Texas Health Action and really complement the sexual health services. I'm really excited about the future where we can put behavioral health and sexual health together and integrate care and focus on the whole person.